I'm a physical therapist and my subject is benzene. I'm going to demonstrate joint mobilization on the shoulder and elbow. The shoulder has a limitation of 90 degrees flexion and abduction, and there is a 15-degree movement on the elbow towards flexion, extension, and pronation and supination. So I'm going to start with the elbow flexion, which is limited to 90 degrees. So I'm going to move my subject to the edge of the bed right here. I normally place a little towel here just to make sure that the shoulder is level and there's nothing happening on the glenohumeral joint. I'm going to perform grade 1 to 4 on this shoulder flexion, and the accessory movement is towards posterior. Okay, so I'm going to stabilize the elbow, and I have the humerus abducted a little bit, and my mobilization arm will be placed on the joint line on the glenohumeral joint. So I'm going to assess the limitation, and it's going to be right here a little bit. Okay, so I found there. Okay, I'm going to perform a little bit of accessory motion, which is a distraction, and then the glide posteriorly. Then I can grade it from here. Grade 1. I'm going to do it twice. Okay. Grade 2, larger amplitude. And grade 3, larger amplitude towards the resistance. Another 10. And grade 4, small amplitude towards the resistance. Another 10. Okay. Now we're going to go to do the shoulder abduction mobilization, and same thing. The position is in supine position, and I'm going to keep my towel at the back right here, just to make sure that there's nothing else is happening on the glenohumeral joint. I will support the subject's elbow with my right hand, and my mobilization joint will be placed on the glenohumeral joint, particularly the clavicle right there too. And I'm going to perform the assessment to look for the limitation. Okay. Now I'm going to do the mobilization with my thenar and hypothenar compartment. Grade 1. Another 10. Yeah, we're doing the oscillation with 10 repetitions, and we're doing it twice. Grade 2, larger amplitude. Grade 3, larger amplitude towards the resistance. Okay, and then grade 4, I'm going to get closer to the joint line. Small amplitude to the resistance. Okay, right there. Okay. Form the external rotation and then the internal rotation. In the external rotation, I have the subject's humerus position into 90 degrees, and I'm going to look for the resistance right there. Okay? Alright. Now, to do the accessory motion, I'm going to preposition the patient's humerus into external rotation, and I'm going to apply posterior glide with my physiological external rotation. Okay, now I can grade it, grade 1. Grade 2. Grade 3, larger amplitude. And grade 4. Okay? Now over the internal rotation, we're going to do the opposite. Still, I'm going to position the patient shoulder into 90 degrees, and I'm going to look for the limitations. Okay. Then I'm going to position myself, supporting the subject's elbow, and I'm going to apply the accessory motion, glide towards inferior there, with rotation internally. Right there, and glide. My hand is positioned here directly towards the joint line. And grade 4. Small amplitude. Okay. Now I'm going to perform joint mobilization on the elbow, and our subject have 7 to 8 over 10 pain. So what we're going to do mostly is modulation, and then progress it to joint mobilization. I normally place a towel on the patient forearm there, just to make sure that this is straight and nothing else is going on the glenohumeral joint. First, I'm going to do the olecranon scooping, where I position the patient's hand on my shoulder here, and my hand is directly on the joint line over here. Okay, and I'm going to apply an accessory motion, which is distraction. Okay. Then I can grade it from there. You okay? All right. Now with this one, I'm going to perform the physiological flexion. So it's like this. I'm just moving my body forward. Okay? So that's for the shoulder elbow flexions for pain modulation. And to progress that, what I usually do is I put my hand on the joint line here, and then apply force downward with my right hand, and force applied towards flexion with my left hand. Okay? So normally you're going to look for the resistance there. Okay. Now for the extension, I prefer the patient in prone position. Turn around. Okay. All right. move to the stop sign. Okay. Now, for flexion, extension, this is the preferred position is in prone, and I applied. I get my left hand here and look for the resistance. Okay, and I cuff the elbow joint here with my left hand. Okay, now let me see. It's not. Let me use a towel here. There you go. Now, here's what we do. We're going to apply the anterior glide here. And I'm doing my physiological extension as well. And a little bit of supination. Okay, then I can grade it from there. 1. Almost none there. Another 10. Okay. Grade 2. Larger amplitude. Okay? From the pronation and supination of the forearm. Okay, so we're going to palpate for the radial head, which is actually down below right here. Okay, now our patient has a pain, so we're going to start with the pain modulation towards pronation. I'm just going to move it like this, to and fro, with my thumb on the right thumb on the radial head. Okay, now for supination, we're going to do just the opposite way, towards supination, to and from movement. Okay, so you're going to start from there to modulate the pain. All right.